Alfie Stirling is Director of Research and the Chief Economist at the New Economic Foundation, is on the line to us right now. Alfie Stirling, good morning.
Good morning.
The ramifications for the economy, which has been faltering during this COVID pandemic, would be sizable, would they not, if the nighttime economy takes another hit?
So unfortunately, that is the case. But it's also true that were we not to get this virus under control, or if we were to let it slip away from control for a second time this year, then that would also have incredibly severe impacts on the economy, which is why in the short term, there are trade-offs to be made. There are real questions and quandaries over the design of policy. How do we get people to social distance properly without harming jobs, while at the same time putting in economic support? But in the long run, actually, it's quite simple. There is no trade-off between public health and the economy, because you can't have an economy operating if this virus is out of control.
Yeah, so you've got to get the virus under control and keep your people healthy. Then they can undertake economic endeavours. What about the idea that if we are going into another phase of retraction, of more control, of more limitations on people, that the government support in the way of supporting salaries or just in terms of giving an uplift to benefits, should that now be extended, do you think?
It should be an absolute priority in terms of economic policy. It's really, really fundamental. So we need to see an extension of the furlough scheme, which is the job retention scheme that pays people a portion of their salaries and allows employers to keep them in work. We should see an extension of the self-employed income protection scheme. But most importantly of all, we do need to see universal credit properly resourced, properly financed. We've had about 1.5 million people so far fall through the gaps in income protection schemes for workers and self-employed. And these people are now leaning on what is the weakest social security system in Northwest Europe. About 15% on average of salaries is replaced by universal credit. It's barely enough to live on. And unless we support that and sort it out, people will really struggle financially, and they'll struggle to not work, which has knock-on effects then for the transmission of the disease.
Now, clearly, we're racking up record levels of debt in order to try and deal with this. When you say furlough should be extended, would you make that universal as the first furlough scheme was, or would you target it a bit more narrowly?
I think it needs to mirror the extent of social distancing and social regulation. So if we have very broad-based, far-reaching tightening of social distancing, which we'll find out later today, then the furlough scheme needs to be equally broadly based to give that support. If it's more targeted at particular sectors or particular regions, geographies of the country, then the furlough scheme should equally be more targeted and more nuanced. So I think there has to be a mirroring there. And I think that a key thing coming out of this recovery will be ensuring that we're creating the new jobs for the future as well. I don't think anyone believes that in 12 months' time or 24 months' time, whatever it is, when we get back to a new state of normal, that the economy will look like what it did at the beginning of this year. And so we need to think really actively, proactively and creatively about where are those new jobs going to come from. Insulating homes, the green sector, the jobs that are critical for our public services like social care, like public health. We should be thinking now about how we create those jobs for workers in the future.
And just to guide us, when you look at the universal credit, and you've made the criticisms of it as being such a modest sum people can't afford to live, that has impacts on the obedience level of lockdown, doesn't it? Because we're hearing many anecdotal stories of people cannot afford to be ill. Therefore, even if they've got any kind of symptoms or even ill, they'll carry on working and they need the money.
That's completely true. I mean, universal credit has been an ineffective and punitive system now for half a decade. And one of the underlying philosophies is if you give people really the bare minimum to live off, and they're forced back to work financially, which, as I say, is probably is highly ineffective and immoral in normal times. But in a pandemic, it is a complete disaster, because you need people, if they're being asked to stay away from work, to do precisely that. And if they're not given the financial resources to do so, we're actually jeopardising not just the health of those individuals, but of course the health of the entire society.